Hmm?
See if I can see everyone. There we go. Okay, well, hello everyone. I'm really glad to be with you all. Morning time for you, but evening time for me. Can
Hi,
everyone
Gabby.
hear me?
Yes, could you put it in the present mode because we see small screens with the notes.
Okay, let's see. Let's swap that. Thank you for letting me know that. Swap. Did that fix it for everybody?
That's good.
Good. Okay. Well, I'm glad to be with you. It's like I said, evening time for me. It's 9 o'clock here, p.m. And so I'm just finishing my day, but I'm glad to be with you all in the morning. Um, my name is Gabriella Huff. I'm an alumnus of the American University Evaluation Master's Program. And I am going to be talking a little bit today about evaluating projects for complexity. But just to give you a little bit of background about me, I started my career off in the nonprofit sector and came to love everything about evaluation when I was working on projects that included it. And so I actually switched careers a few years ago and got my master's through American. And now I'm working as an evaluator with the local government here where I'm located. So um, it is a journey, and I see from many of the expectations that you all wrote that you're starting there as well. And so welcome to the evaluation world. And I'm excited to be with you today to share a little bit more. So I want to start by saying you've probably spent a couple of days here learning about different kinds of evaluation and different parts of evaluation. I know I'm coming toward the end of the boot camp. And so I want to share with you a different approach to evaluation that is not for every project, but is definitely um, very important in certain projects, and that's complexity aware evaluation. And before I jump into it, I just want to say that this is mostly based off of a discussion note that USAID put out in 2021. And so I have the information for that article for further reading to share with you after. But let's go ahead and jump in and take a look. So while we're together, we're going to be talking about complexity in terms of what is it in evaluation? How do we define it? How do we quantify it and operationalize it so that we can measure it? I'm going to be sharing a couple of tools that I've developed based off of the USAID brief that help to make the process easier to work with clients and help them to understand complexity as well, because it can be a little confusing. And then I want to talk a little bit about the advantages and the limitations of using this approach. There are times where it's really appropriate to use it, and there are times where it isn't. And so I want to talk about what that looks like. And then we'll have some time for questions and answers as well. So what is complexity in evaluation? Well, I want to have you all kind of imagine that you're sitting at your desk and a new project has been given to you and you're expected to work on it. And as you're reviewing the materials, you're starting to notice that there's a lot of things that are complicated about this project. There's a lot of stakeholders involved. They're from different parts of the community, maybe the government, maybe a nonprofit agency. And the participants get their services from these different organizations. So they're interacting with a lot of people. And on top of all of that, it's a mental health treatment program that is developmental or experimental, and they're still trying to figure out the best way to approach this treatment, which feels a little bit like a mess, right? This feels like it's going to be a hard project to tackle. So what do you do next? Well, one of the things that I would start with is looking at, is the project evaluable? And if it is it a simple or a complicated project, or maybe a complex project. And I want to talk about what that means. So you can think about complexity kind of on a chart like this is here, this blank chart. And on one axis, we have the level of agreement. And that is going to refer to when you get all of your stakeholders in a room, how much agreement is there about the activity that they want to implement to solve the problem that they're all there to solve? Do they agree on what the best course forward is? So a level of high agreement might look like if you're evaluating a program that delivers vaccines to rural communities. If all the stakeholders agree that this will decrease the incidence of disease, then you have a group that has high agreement. If some of the stakeholders are suspicious of vaccines or concerned that they may not be the best solution to decrease incidence of disease, then you have a lower agreement among your stakeholders. And that axis follows the y-axis there. And then on the x-axis, you have the level of certainty. And this refers to certainty about how the work will be carried out. So if we go to our vaccine example that we just used, this would be a situation where maybe all of the stakeholders now agree about the way to do this project, right? They agree that vaccines are the right thing to do to lower the incidence of disease, but they don't agree about the best way to get this out to those rural areas. Maybe it's a very under-resourced area where the health system isn't able to support a large project. Maybe there are cultural or local things at play that make it difficult to do this project in that area specifically. But either way, you wind up with less certainty among the group about how this should work. So when we're thinking about complexity, we're really thinking about these two concepts, certainty and agreement. And as I'll show you, it kind of changes the way you approach measuring a concept. So if we're looking at a simple element of a project, and this is related to maybe an activity within the project that you're evaluating. This could be related to the way they deliver something logistical, or this could be related to something administrative. But you want to look at each element of the project and understand, is this simple, is this complicated, or is this complex? And a simple element of a project might look like having high agreement and high certainty in both elements. So if we look at our vaccine example, that would mean that the group of stakeholders all agree that this is the right intervention to decrease incidence of disease, and that they have a way to get those vaccinations out into the rural communities without a problem. So they all have a really high certainty level that this will be able to be implemented. That's what you would call a simple element of the project. Typically, these elements are repeatable, and you can usually see a relationship between the two variables already that's clear. Vaccines decrease the incidence of disease. That's very clear, right? So that's what a simple element of a project might look like. And you'll see in this chart on the opposite end where there's low certainty and low agreement, the word chaos. And that relates to when there's very little to absolutely no agreement or certainty. And when there's no agreement or certainty, it's not typically able to be evaluated as a project, because if all of the stakeholders don't agree on the intervention, they're not sure that it's going to be able to be implemented correctly, then there's not much to evaluate, right? It's difficult to evaluate something where the folks who are implementing it haven't quite gotten to a point where they all agree. So we don't ever want to end up in the chaos area, but there are some middle areas that we can look at as well. And one of those areas is complications, right? So there's two different kinds of complicated elements to a project. And that can be a social complication or it can be a technical complication. So on the graph, you can see that the complication comes when an important part of the project has really high certainty among stakeholders, but low agreement among stakeholders in the other axis. So for instance, if a community initiative that distributes harm reduction items, so something like a drug that can stop a drug overdose, or clean needles for those who are using drugs to reduce their risk, right? A program like that. Maybe everyone agrees that the activity could be carried out well, but they don't agree that it's the best activity to reduce overdose deaths in the community. So in that case, we're looking at something that's socially complicated because among stakeholders, that's where the disconnect is. It's not in the carrying out of the program, it's really in the philosophy behind the program. And so you can look at this and see that social complication can get in the way of evaluation as well, right? Because again, how do you evaluate something where the stakeholders don't agree? And so sometimes that takes some work to get stakeholders on the same page and facilitate those conversations. But you can also have complications that are more related to technical pieces. And so that happens when there's high levels of agreement among the stakeholders. They all agree that this is the right activity to reduce the problem, whatever that problem is. But they don't agree about how to carry it out, or they don't believe that there's an infrastructure to carry out that program. So back in our example about distributing drugs or other harm reduction items, this might mean in that case that stakeholders agree that they can carry out the activity. Excuse me, they can they can oh my gosh, sorry guys, I just lost my place. So let me reset here. Stakeholders agree that they can that this is an intervention that is going to help the community, right? So this is going to reduce the incidence of overdose if they can do it. But maybe they're not sure how they're going to do it. Maybe the area is under-resourced and the health systems aren't able to distribute these. Maybe they're looking at public services like the police or like emergency services, medical services that come to administer these things in emergencies, but maybe they're not resourced enough to be able to work an intervention like this into their workflow. And so that situation, we would say it's technically complicated because we know that the philosophy underneath is solid. All the stakeholders agree that this is something that would move the project forward. But technically speaking, they're not sure how they're going to do it. So these complicated elements are really on one front or the other, not both. And that is something that can be worked through as you're working with stakeholders as well. But I think it's important to show the difference between complicated and complex elements, because when we talk about complexity, we're really talking about lower certainty and lower agreement. So complexity kind of lives in that middle zone where it's not chaos, right? There is some agreement, there is a little bit of certainty, but there's not agreement and certainty in the same element. So it can be present when that's the case. It can be present, complexity can be present when there are many stakeholders to coordinate, because coordinating a lot of stakeholders to all agree and be certain about the intervention all together at once is a lot to do, right? So that can create complexity as well. So it's important to go into a project if you're getting the sense from the materials you're looking at and the people you've talked to that the project is going to be complex, or there's going to be complicated elements of the project, that you know what you're looking at so that you can evaluate these things properly. And something to remember when you're looking at complexity as well, especially if you're evaluating outside of your own cultural sense, right? So if I was to evaluate a program in Kenya, for instance, I'm obviously not from Kenya. And so I wouldn't know all of the fine details that might present additional complexity. So there might be cultural customs that need to be observed. There might be different things that should be avoided to make sure that we're respectful. And so when you're going through this process and looking at complexity in a project that comes across your desk, always think a little bit about culture. Sometimes even from city to rural or rural to city, it can be very different. So keep that in mind. So now that we kind of understand a little bit about what complexity looks like and how we're defining that, what do you do with that information? Well, when a project like this comes across my desk, I always do two different analyses. And that's a project element rating, as I call it. It's not a scientific term, I made that up. So I'll show you the tool. And I also do a stakeholder analysis. And I think these two tools help to really put the project in perspective so that I can decide a couple of things. I can decide if the project is evaluable, right? Is there enough agreement and certainty among stakeholders that we can evaluate this, or is it kind of chaotic? And it also helps me to decide how I'm going to measure each element of the project. And I'll show you a little bit more about what I mean in a sec here. So let's jump into these tools. The first tool that I have started using is a matrix of the different elements of a program. And this is an example of a mental health treatment program. And I've listed out all of the different elements that are consequential to the evaluation and to the programming. And this will be important later on when we go to start making models, be that a logic model or something different and a little bit more complex leaning, like a systems map, which I'll show an example of. But this helps to kind of put those things out and let us categorize them, right? So I've listed them all out here. And what I did next was go through each one and decide whether or not I felt with the stakeholders involved that there was agreement among the stakeholders and if there was certainty among the stakeholders about each individual element. And I've categorized that here so that I can see it all in one place. So there's elements that you can see here that are relatively straightforward. So for instance, this is an example of a treatment program for individuals who have a form of obsessive compulsive disorder, hoarding disorder. And one of the things that the treatment involves is psychoeducation, which is educating participants about their own disorder so that they can recognize their own patterns and see their own symptoms, right? And so that's pretty straightforward in terms of agreement. Psychoeducation is something that's in the literature and in practice well known for increasing the positive outcomes of patients. And so there's a lot of agreement about that this is one of the right interventions. So I can check that box. With certainty, we're looking at how do you carry this out? And is there certainty about the way that will be done? And in this case, there is. There's a therapist that visits the participants daily and engages in psychoeducation. And so there's high certainty about the way that that would be carried out. So I can say that this is a relatively simple part of the program. Something a little bit more complex, though, is something like medication use. So here in the US, hoarding disorder was only added to our DSM, our mental health reference book, in the last 10 years. And so there's not a lot of agreement yet among experts about which drugs might be helpful. The research hasn't quite been fleshed out yet. And so there's not a lot of agreement that shows that medication is the best treatment. And then looking at certainty, how would this be carried out among participants? Well, do participants get prescribed the medication and they're responsible for their own administration of that medication? And is that reliable? Will there be high medication adherence if participants are in charge of their own medications? And then along with that, what is the best way to administer? Is it a daily pill? Is it a weekly injection? There's not a lot of certainty about the best way to do that in this project either. And so we're looking at an element of the project that has low agreement and low certainty. And so that's a much more complex part of the project. So this this kind of matrix that I use creates line items that help me to categorize these things and see them all in one place. And that way I can judge them independently of one another, right? So the way I might use this is to say that, okay, maybe psychoeducation is something that I can measure with a more conventional methodology, right? Maybe I can use a pre-test and a post-test for that. And I'll be able to see, has the knowledge about someone's own disorder increased after they've been given psychoeducation versus before? I can test that. Whereas medication use and whether that is effective is a little bit more difficult in terms of how am I going to measure if the medication use has improved the symptoms of the disorder. Much more complicated. So I hope that kind of explains the way that I use this, and I'll show you a little bit more about that in a minute, but I want to look at the second analysis. And the second analysis that I use when these projects come to me is this stakeholder analysis. And I like to start by listing out all of the collaborators or stakeholders that are involved in the project and listing their role in the project, right? So a program participant is obviously there to participate in the programming. The family of the participant is maybe supporting the participant, whereas a therapist or a social worker is there on a professional basis. They're there to support the programming. And someone like a funder is there to provide financial or material support to that programming. And then the next step of this is really to look at what is their interest in this project? Why are they there? What do they value? And really importantly, do they have power in the process or not? So someone like a program participant who's in a mental health treatment, for instance, if we go back to our example, is there to improve their quality of life. They value seeing their own successes and being able to maintain control of their disorder. And inherently in the process, since they're doing the receiving, they don't have a lot of power, right? They're not the professional in the room. They're not the person who gets to make decisions about their treatment. They're receiving treatment. And so they inherently have less power in the process. And this is something to keep an eye on, because as an evaluator and focusing on equity and making sure that everyone is heard throughout this process, you might want to ensure that the participant and anyone else who doesn't have power in the process is asked their opinion, so that we're sure we got everybody's opinion. Whereas someone like a therapist who's there on a professional basis, their primary interest is identifying and diagnosing and then treating that disorder that they find. They value the participant putting in effort and improving in the treatment area. And because they have a position where they are deciding progress, they're deciding quality of sessions and those sorts of things, they inherently have power in this process, right? And so even though we want to hear their voices well, they're not someone we worry about as much in the process. So everyone should include and value their opinions throughout the process. But this is not one that we want to make sure gets included because they're not as powerful in the process. So this becomes a really important analysis when you're looking at issues of equity, because you can kind of come in and choose to lift up those who don't have that power. And that's one way that I use this analysis. I also use this analysis to help me prepare for if I have a complex evaluation, right? I've gone through my initial analysis where I kind of ranked everything by complexity, and I know for sure there's complexity in this project. I'm going to use this to help me create a systems map later on. And so this is a good first step to that visual map that we would create later on in the process. And I will show you an example of that too, right? So we've done both of these analyses. We have all this information. What do we do with it? Right? We got to put this into action. So this is how you use your situational analyses. The first thing I always do is share my findings and recommendations with the client. In complex evaluation situations, being participatory or including all of your stakeholders is very important to make sure that you're reflecting the group's interests and also the reality of that situation well. And so looping them in as much as possible in this process is important to check yourself and your understanding, but also to make sure that they're included and we have everyone's voices heard. The next thing I would do is use the analysis that we've created and the participation from your client to create a visual theory model using a systems map or a different tool like a logic model. And what you may be used to seeing is a logic model that looks like this. This is a linear logic model, and this reads from left to right, inputs and then activities, outputs, outcomes, and impacts. And as you can see, they've kind of filled this out to show what each of those looks like. An output is looking at an immediate outcome of an activity, something like counting the number of folks who were trained. Whereas an outcome is looking at a change, a desired change. And so we want to know whether their knowledge about the college application process has increased, whether or not their aspirations to go to college has increased. And so a model like this is what we call a linear model because it is one line from left to right. In complex evaluation, sometimes it's not that simple. Sometimes we know when we have a lot of stakeholders involved that looking at a model like this doesn't paint the whole picture. And that doesn't mean it's bad or not as good as another model, but it is for a specific situation. And if it is a complex evaluation and you identify that, then you could do something more like a systems map. And this is a systems map that I created for that same project. That is mental health treatment for people with OCD, hoarding disorder. And I hope it's big enough for you all to see. I'm not sure how big the screen is, but it is a map that goes all around looking at all the different pieces of a hoarding disorder program. And as you can see, there's a lot of pieces to this, and some of them connect to each other. Some of them connect just to one thing, but they all go into the program participant and getting those services to the program participant. And one thing I'll point out about this map is you can see that there's a background behind the little bubbles, and that little blue background is what we call the boundary area of a systems map. And the boundary area is looking at the scope of your evaluation and the scope of the program. And so if we're looking at this program, much of it is in scope. The things that are out of scope are the funders, right? We may not be engaging secondary funders in a project like this. We might, but in this case, I wasn't, because the funders were various. There were many of them, and so the program staff felt like they didn't have a place in the evaluation group. But we did have leadership from the department involved. It was just the larger organizational leadership that we didn't have involved as well. So they're sitting outside of the boundary. And then you'll see other stakeholders sitting outside of that boundary line as well. The local government resources, housing, aging, cleaning, legal, other resources that these individuals were engaging as part of their treatment, but that didn't necessarily live in the same organization, right? So they're involved, but they're not within the boundary of this evaluation in terms of what I can measure. And then another one on the outside there are those emergency medical providers and the hospitals that individuals might end up in. Frequently with hoarding disorder, they'll have accidents in their homes because they're surrounded by a lot of different items. And so they'll trip or something will spill, and then they'll get injured, and they wind up in the medical system quite a bit. And so those individuals are certainly part of the system, but not a part that I can evaluate. So we're looking at the infrastructure of the case managers, the therapists, and the in-home coaches that go daily to these individuals' homes to treat them. And then you can see it flows into the treatment types, the assessment types, and that all goes through the program participant as well. There's also a couple of loops for reporting on the top that are in red. And while this is complicated to read for the first time, very complicated to make for the first time as well, it is a really more realistic look at how these individuals are being treated, who all exists in that ecosystem, and what this looks like. So when we're looking at a more typical tool like a logic model, this is typically used in impact evaluations and in evaluations that are looking at outcomes. A systems map, on the other hand, is not necessarily built to look at impact, but is built to be very realistic about complex situations. And so it's important, again, to make sure that you're using the right tool. And this lends itself a little bit better to complexity. So you've used your analysis and client participation to create a visual theory, either with the systems map or the logic model, or another tool. The next thing that I would do is say, based on the systems map and what that looks like, what the nature of the activities are, meaning, are they complex? Are they complicated? Are they simple? The next thing to do is decide what methodologies are appropriate to use. And so you can use complexity-aware methodologies like most significant change or outcome harvesting, which I'm happy to talk more about. You could use a qualitative methodology, a quantitative methodology, or you could use any of the above together. Frequently in complex evaluations, I will use a mixed methods approach because sometimes those elements are complex and not evaluable with typical methods. But some of the elements of the project are simple. And so we wind up with this kind of mixed group of elements, some simple, some complex, some complicated. And you choose the right methodology for the job. And so sometimes that means I wind up with a mixed method study. So that's the next thing that I would do. And finally, I would say evaluate. Once you've got your methodology in place and you understand your project, you're able to communicate to funders and other stakeholders about what this infrastructure looks like, what this project looks like. Go ahead and put together your timeline, your budget, and make sure that you're sharing that out with stakeholders as well. So before I wrap up here, I just want to share a couple advantages and limitations. So some advantages of using these analyses and of complexity-aware evaluation in general is that these analyses can help you identify what elements of your project are complex or complicated. Complex project elements, when you use this method, become clearly defined, and you're able to decide on methodology much more on a more detailed basis, because you're able to look at different elements of the project rather than just the project as a whole. It's also very participatory in nature because it increases stakeholder engagement. You need information from stakeholders and clients in order to do a complex evaluation. And so by nature of that, they wind up talking more to you and you learn more about the program. Some limitations of using a methodology like this are that the deliverables, that end product, if we're talking about a systems map or these analyses, are a little bit more abstract. They're not as straightforward as a logic model, where we can say, if we put the inputs in, then we can do the activities. If we do the activities, then we can contribute to the outputs, and so on and so forth. We're not able to say that as clearly in a complex situation. And so that means that often those elements of the project are more developmental in nature. And because we're using a nonlinear model, we're not able to show impact as clearly. So if you're looking to do an impact evaluation, this may not be the correct methodology. And there are places where it's really appropriate. So areas like social justice or situations where you have a lot of stakeholders involved and there's a lot of interventions happening, complex methodologies can be really useful. However, if you're looking to show impact, to say that this intervention substantially contributed to this outcome, it's going to be a lot harder to show that because there's no straight line through like there is with a logic model. And the last point I'll say is that it requires some in-depth participation from the clients. And so when you're working with your clients, it's important to really take their temperature or really assess them and understand how much involvement do they want to have in the evaluation. If they don't want to have a lot of involvement in the evaluation, or they're not interested in an in-depth look at their programming, this might not be the right methodology either. So it's just important to really keep an eye on the project as a whole and understand whether or not this is the right fit for your client. So I will stop there. This is some of those articles. I'm happy to share these out as well, not in slide form. But these are additional resources that will help understand if you're interested in learning more about complexity theory, complexity in evaluation, or learning about those systems maps. This will help you to learn more about that. And I also have included a link to the templates for those analyses as well. So I'll stop there for questions.
Yes, well, thanks very much, Gabby, and a round of applause for you from the audience.
Thank you.
Okay, any question, clarification from our participants?
So I do have one question. So I organized the stakeholder meetings before. So then I try to use the brainstorming method. Maybe like one person can talk the 1 minute, something like that, then no judgmental. But when there is an open discussion, so I found out that people who has a knowledge in that topic, or someone who has a high power, they can talk a lot. So then how can I to give the possibility to opportunity to everyone to attend the stakeholder meetings? So is there any tips for me?
Yeah, of course. That happens so much. It is incredible. I would say that a tool I like to use when I hold stakeholder meetings is to individually invite people who I believe might be helpful. And do that in a non-public way so that they are able to think and respond, and they're not in front of a group of people. And then when we get to the stakeholder meeting, I like to use something called participatory activities. And these are ways to gather information from the folks who are there without making it an open discussion. And so one that I like to use is to take sticky notes or pieces of paper and pose a question and ask them to write as many thoughts as they have on the sticky notes. And then I collect those up and I put them out on a board or on the wall. And then we can kind of go around and do a couple of different things, right? We could share or do a walkthrough and have everyone look at the sticky notes and star the ones that they thought were really thoughtful or really important. And then we can look at the ones all together as a group that have a lot of stars on them. And I, as a facilitator, can say, this one really resonated with everyone in the room. Whoever wrote this, would you be willing to share a little bit more about it? Or if someone really felt like it was a strong contribution, why did you star it? And that kind of opens up the conversation a little bit more to allowing for others who aren't quite as loud or maybe not as powerful to share their opinions. I would also say, make sure that you're asking for participation. Sometimes as the facilitator, it can be really intimidating to have this group of people and there's one person that talks and you want people to talk, so you let them talk. And it's okay to say at the beginning of the meeting, I'm really excited to hear everyone's contribution. And I'm going to kind of put a time limit on responses, and I'll let you know when you're getting to the end of that time limit, and we'll wrap it up and listen to the next person. And then when it's quiet and no one's talking, you can just kind of let it be quiet. People inherently don't want to sit in silence. It makes them uncomfortable. And so someone will speak. And if it's not necessarily someone you've heard from yet, you can always turn around after their response and say, yeah, thank you so much for that. Is there anyone who hasn't spoken yet that would like to share? And then wait. That would be my advice. There's a lot of waiting involved. But yes, that's a good question. It's a common issue. And yeah, it's just about involving as many people as possible.
Hi, and thank you so much for this very interesting and insightful presentation. I have several questions. First, about the methodology, I would say you emphasize the importance of participation of the key stakeholders. What if some stakeholders are not available? How would you read agreement, or you simply drop this methodology? And also how to avoid the judgment of certainty to be too subjective. You know, there are different project elements, and you really need to make a lot of judgments. Sometimes you need special expertise. One is related to medical or, you know, other areas of a profession. So, and another question is, you mentioned that the system map is non-linear. It's so true. In reality, even series change, as you shown, a typical series change is a simplified dynamics of intervention. In reality, nothing would be linear, right? And then, but also at the beginning of an intervention or project, we usually use a series change at the design stage to guide the design of the intervention. And then when it comes to evaluation, sometimes we require the evaluators to reconstruct the series change. In this case, if you use the system map at evaluation, how would you, resolve this, these two different tools at the design and the evaluation? Thank you.
Yeah, so I'm gonna try and remember all the questions. So if I don't, remind me, please. So I think your first question was related to methodology and what to do if stakeholders don't want to be involved or they're not able to, right? I think in this this time in the world, there's a way that stakeholders can be involved, even if they're not present. So if that means a Zoom call like this, I've conducted stakeholder meetings over Zoom. And that's doable. It's not as personable, right? You're not as able to build rapport, but it is possible. And so that's a tool that I use frequently. I also think that you can conduct the activity I was mentioning with the sticky notes or the paper in the room of a stakeholder meeting. You can conduct that by soliciting that feedback before a stakeholder meeting. And if folks aren't able to join the stakeholder meetings, maybe in advance they can give that feedback, and the other stakeholders can participate in real time or beforehand, and their thoughts will also be elevated in that meeting. So if it's an issue of being able to be there at a certain time or place, I think there's ways around that. I would say if your stakeholders don't want to be involved, this may not be the right methodology. And I say that with a heavy heart because it is sometimes the right methodology, but it's not the one that's going to work. And so there may be a more linear methodology that better fits the needs of the clients. And at the end of the day, they're one of the stakeholders who are requesting this evaluation. And so you also have to take their thoughts into consideration as well. I think, you mentioned a question about some areas of certainty or agreement require some expertise. And sometimes that can reduce the amount of certainty or agreement that you might have in a group of stakeholders. And I would say one thing to elevate when you're in this space of trying to get that agreement and trying to get that certainty is to elevate the experience of the participants. They are experts in their own lives. And so whatever intervention or program is being run to assist any group of participants, I think it's important to recognize that while there are experts, maybe doctors or professors or researchers who do have expertise in certain subjects, the individuals who are living that situation also have expertise. And so it's not, like I said, inherent to them to have that power to speak, but I think it's on us as facilitators to give them that power and to ask for their opinions, and to include them so that their voice is heard as well. And oftentimes, this comes down to a scope of a project. People can get very confused about where the project ends. And sometimes it's not a project that evaluates the entire program, right? Maybe it's just evaluating one piece of the program or one piece of an organization. And I think it's really important to remind people of scope when there's a lot of disagreement as well, because sometimes what they're talking about, their expertise may be really valid. And it may be that they are correct that, if we were to include another area in the scope, we would have to think about this differently. But making sure that you're appropriately scoping the project and putting those boundaries up around what's included and what is not might help with getting some of that agreement and certainty as well. Will you remind me of your last question? I think that's the one I missed.
Last question is about usually at the design stage of a project intervention, we use the theory of change, but at the end, when it comes to evaluation, if you use another tool, so how do you reconcile these?
Yeah, so I do not use a theory of change model when I'm using complexity aware evaluation. I use my systems map as a theory of change, and I also use it as inspiration for how I'm going to measure what I'm looking at. So inherently to the methodology of complex evaluations is that it can be really developmental, or meaning like we don't necessarily know what the outcome should be. We know what we want the long-term goal to be, but we don't necessarily know what success looks like when we're doing our program. And so methodologies like most significant change or outcome harvesting are methodologies that will allow you to explore that with a little bit more ambiguous or unclear outcomes. And so when you get kind of into the system map, you'll see what those relationships start to look like. And you can kind of see, oh, I should be measuring this, right? This is an important relationship. And you can start to do that by using a developmental or complex aware methodology where we don't have to set necessarily a firm outcome, but we know what the general goal is. And so most significant change is a methodology that asks, if you're not familiar with it, what the most significant change has been to a participant.
We do have a session on it yesterday.
Oh, perfect. So you guys are all up to date. So that will allow you to look at this in a more complex way, right?
My
you don't have to know.
The question is, when you at the point you're on board to do this evaluation, I assume there was a theory of change already there, because at design stage and also to guide the monitoring, and they need some like a framework, right? How would you convince the stakeholders, okay, let's switch to another tool and this is the most suitable one?
It's a good question. I would say it's very situational. Sometimes, depending on what the client is asking for, it may not be appropriate to use this methodology. If you think it is appropriate to use it and the client would be open to that, then I would just have a conversation with those stakeholders and say, in my opinion, I think there's a lot of complexity to this project, and I want to make sure that you get the most accurate data and the most accurate look at your programming. And this is a much more, new generation methodology that we're looking at. But this would be my recommendation. And you can do that as an expert, right? This is my recommendation. And also, depending upon what they think and what they say, you might want to have a backup plan and just say, okay, if you're not interested in looking at it from a systemic point of view, this would be my recommendation. So you really have to kind of have your pitch ready. And if you feel that they're on board and they understand, that's great, move it forward. If they don't, you might have to decide whether or not, A, that's the right project for you to work on, if you have that luxury. I work in the local government and I don't get that luxury. So if it's not the right methodology, you might have to switch and look at what you can measure with a more conventional methodology and just do that.
Thank you. I'm pretty sure most of your clients are open-minded because this methodology is really innovative. Thank you.
Just one more very technical question. What exactly do you mean when you use the word client? Like, is it your evaluation commissioned client, or I saw that on your slides you also used the client sphere and pointed to the program participant. So when you specifically say share your situational analysis result with your clients and get their feedback kind of things, does it mean all the stakeholders or program participant or your or the one paying you? I'm not sure.
Great question, and I apologize. I know that client appeared twice. The client is the language that that organization I was working with uses to describe their participants. And so that, in that sense, when I'm looking at that client sphere, as you mentioned, that's referring to the participant for that particular project. But outside of that, when I say client, I am meaning the person who has commissioned you to do this, the organization or the office that has approached you to create that evaluation.
Any more last question? Can I ask question? So I really appreciated you gave the definition in the axis between the simple, complexity, and complicated. Previously, I had thought that rigorous means complex, but it seems like in the axis, the more simple it is, it's more rigorous. Or maybe not, but how does the rigor of the evaluation stand in that axis?
You know, I think that's up to you as an evaluator and the possibilities of the project itself. For instance, one project I'm working on now that's very complex is a collective impact project, and it's related to reducing deaths in our community due to opioids. And while it's very complex in that there's a lot of stakeholders, there's a lot of different things going on to try to prevent that from happening. There are initiatives within it that are very simple. And that can mean like you refer an individual to a drug treatment program, and we can measure whether the drug treatment program decreases their use of opioids, right? That is a simple measurement. And we can be pretty rigorous with that. We could do a pre-test, we could do a post-test, we could do analyses, post facto on the demographics of the people who do better or the age of the people who do better. And so sometimes the more complex it is, the more kind of smaller pockets there are where you can do more quantitative methodology. And so rigor doesn't always mean complex, and complex doesn't always mean lack of rigor, if that makes sense. So you can kind of decide that in your methodology yourself. Is it possible to measure from a quantitative point of view? Or do I not know what the outcome should be? And I need to solicit that information using something like most significant change, right? So it depends, but there are certainly situations where you can use more rigorous data gathering and methodologies, even within a complex situation. So it's a non-answer. It's kind of what you decide and what's possible with that project.
Mhm. Thanks very much, Gabby.
Yeah.
And I
Thank you
that's
all. Nice to meet you all.
presentation. Yes, thanks very much. And so you will share the presentation with us and we can distribute. Right. Okay,
Perfect.
great.
Will
Thanks very
do.
much, Gabby.
Thank you all.
Good night.
Bye.